Hi, I'm Rosie Smith, your hostess of Health Matters, the health information show that has all the information that matters most to you and your family. We are so excited that you have joined us today because our topic is all about stroke awareness, something that most people usually don't want to talk about, but it's really important to understand the signs and symptoms of stroke for maximum survivability. Joining me today is Jason Jerkins. He has an RN degree from Chipola College right here in Marianna, Florida, and he is the director of the emergency room. Welcome to the show, Jason.
Thank you for having me.
And joining him to his right is Sarah Thomas. She also has her RN degree from Chipola College and a Bachelor of Science in Nursing from the Florida State University. She is the director of two really important units. One is special care, which you can think of as an intensive care unit, and the other one is a step-down, fully monitored progressive care unit. Sarah, welcome to the show today.
Thank you.
All right, well, today is a really important topic, but we're going to try to break through a lot of the complicated facts and maybe misnomers and talk about stroke awareness. So what would a patient or a community member of yours today want to know in a nutshell about stroke?
Well, thanks for asking, because stroke is very important and has touched everybody in the community. Stroke is the fifth leading cause of death and the number one cause of disability, not only in the U.S. but also in Jackson County. So Jackson Hospital has a clear and strong commitment in treating stroke patients, and we're actually looking forward to increasing our abilities to provide even better care by attempting to become acute stroke ready. And basically what that is only one in 5 or 6 hospitals in the whole state of Florida have this. We will be number 4 if we get the certification. And what that means to everybody in the community is we will be able to provide top-notch stroke care to the people of Jackson County and the surrounding counties as well. Every 15 minutes closer you are to treatment, the treatment that we're already providing, that we're going for the certification for, your ability to function outside of discharge from the hospital is increased exponentially. So we're really excited about the program that we're trying to get at Jackson Hospital and what we're able to offer currently at Jackson Hospital.
All right. Well, thank you for that. That's a really good segue into, if somebody is feeling like they're having a stroke, we use kind of carelessly, oh, I had a stroke about that, but seriously, what are some of the signs and symptoms that people need to pay attention to that they may think they're having a stroke? Jason provided a really great segue, kind of an overarching message about what Jackson Hospital is doing as far as stroke readiness. But our viewers oftentimes will say things like, oh, I had a stroke today, or oh, I'm going to have a stroke over that, which they don't mean that seriously. That's just a turn of phrase. So what do viewers and our community members need to know about some of the signs and symptoms of stroke?
Well, the American Stroke Association has developed an acronym, it's FAST.
F-A-S-T.
F-A-S-T, face, arm, speech, and time. If you are with someone and they start having some facial drooping, that's one of the indicators, one of the signs and symptoms of stroke. If they start having weakness with their arms, with one of their arms, hand grips, if their arm drifts down, they can't hold it up the same as they would the other. If they start having difficulty speaking, if they're unable to smile, one side of the mouth or one side of the face is drooping and they're not able to control their mouth. This is also a sign and symptom of stroke. The most important thing when you have any of these symptoms is the time. I want everyone to know to immediately call 911. Take note of when their last known well time was. This is something that the first responders are going to ask, and the ER physicians. This is pretty much ground zero time for their treatment. As Jason spoke of earlier, the clot busters that we're able to give them, we have to go by this last known well time or when the symptoms very first started. So that's also very important. So just the F-A-S-T, FAST.
Fast, so think fast.
Yes.
So, people may be out having dinner or doing a routine family activity, and maybe their loved one starts to show that, the facial droop and the arm weakness. Probably the facial droop would be your first clue, right? I mean, that'd be like something that's very obvious. And so then you need to jot down the time prior to those symptoms and then go through that process and call 911 right away.
And one of the things that we find often is that the people don't want to bother the dinner. They want to go ahead and finish dinner. They don't want to interrupt anything. But time is such a crucial element.
So Jason, why is time such a major factor in stroke recovery?
Well, a lot of people think about strokes as, oh, that's just something that grandma had or something, but we need to take it just as seriously, if not more seriously, than a heart attack. They're actually calling strokes
Wow.
brain attacks
Really?
now. 80% of brain attacks or strokes are caused by a clot or a blockage, just like a heart attack would be. About 15 to 18% are actually caused by a bleed. What we're really after is to diagnose that as soon as possible. And that's one of the reasons we want people to act on that T in FAST, the time segment, because regular time is brain time. So the longer you wait, like I was talking about earlier, the acute stroke ready, for every 15 minutes that you wait before you get treatment, you lose functionality. And whether that means you can't walk like you did normally, you can't speak like you did normally, if you wait a certain amount of time, you actually can pass on. Stroke is actually the nation's 5th leading cause of death.
Wow.
About every 40 seconds, somebody in the United States has a stroke. And that's why it's so important to us here in Jackson County. Those 80% that have the blockage, like I spoke about, getting the clot buster, we have the ability to get a patient diagnosed, treated, clot buster, and then taken to a higher level of care if that's necessary, right here at Jackson Hospital.
Wow, that's a really refreshing to know.
We actually went to Houston, Texas to the International Stroke Convention, and they were really, really pushing and pursuing this acute stroke ready hospitals for people that live in outlying areas like we do here in Jackson County. And they were just really, adamant how important it is, the time. People say, no, take me to a bigger hospital. Well, if that's an hour away,
Yeah.
that could be 4 15-minute time increments that, you were losing, like where you could pick up a drink before, now you can't. A majority of people that are in nursing homes or rehab facilities are stroke patients that have had this amount of function taken away because of the stroke. So that's why it's really, really important for people out there in Jackson County and surrounding areas that if you're having any of these symptoms, get seen about sooner rather than later.
So, what kind of occurs to me is a lot of people feel like, oh, I don't want to, like Sarah said, I don't want to bother the ER. Oh, it's just a little, spell or something like that. Oh, it's not anything serious. So what is your response to that as the director of the ER?
Stroke is one of the most serious things we deal with in the ER. We actually have a stroke alert. And when a stroke alert happens, everything else stops. The CT room is cleared. Respiratory comes and does an immediate EKG. Lab is on the ready. The doctor is meeting the patient at the back door. We're getting a wait. We're getting the patient straight from the EMS stretcher onto the CT table because it's that serious. We think that the sooner you can get treated and get the life-saving medicine, alteplase or TPA, what most people call it, the better. We have seen patients turn around within 15 minutes of receiving the medication.
Wow, that's a
They went from
miracle.
absolutely not speaking and unable to move to that breaking up that early clot and giving them functionality again. So it's really important for people to realize, as we said,
Yes.
the sooner you recognize the symptoms, the sooner we can get you in and get you taken care of here at Jackson.
So nobody's gonna make fun of anybody or tease anybody about, it was a misfire, because you
Right.
just can't be too careless about that, especially with
Right.
time matters so
Right.
much.
And a lot of people, the mentality is, well, let's go to a bigger facility. It's the fisherman's mentality, for the further away is better.
Right.
It's not. In the case of stroke, you need to be treated and diagnosed as soon as possible. And so that's why it's really important that we get this show out there to let people know, hey, come to Jackson, get treated. If we can't treat you, we can get you somewhere soon, and that's already taken care of. The thing with the bigger the hospitals is they usually have just 1 or 2 CTs as well. It doesn't matter the size. If they have a higher capacity, well, that's great, but guess what? They also could have 2 of these alerts going off at the same time,
Right.
which would delay their care. With us being closer and having a smaller population, we've never run into that where we've had 2 at the same time. So we are fully capable of taking care of this patient's needs with a community feel. I mean, because they are the most important person at that time in our ER.
So, and you have this protocol, so like the ambulance is already talking to you on the way, so that way you're ready,
Yes.
that's very reassuring. Why is the CT such an important part of the care?
The CAT scan is the thing that you can determine whether it's a hemorrhagic, which is a very small percentage stroke, or if it's a embolotic stroke, which means it's a clot or a plaque or something blocking a vessel. Both of those decreases the blood flow to certain areas of the brain, and that's where the stroke or brain attack happens. Just like with a heart attack, you're decreasing blood flow to an area of the heart. With the brain, it's a lot more serious, because at that point,
Kind of got to have that.
you lose everything else. And so if it's hemorrhagic, they don't usually take them off the EMS stretcher, or if they do, we have them, a transfer agreement worked with facilities around that can handle the hemorrhagics. Now, if it's hemorrhagic, we'll have to get them somewhere else, but it's a very small percentage of the stroke patients that fall in that category. If it's one where it's a blockage, then we can definitely go ahead and take care of that. We actually have neurologists via telemedicine, which is a very cool thing. We call him Jack. But as soon as the stroke alert happens, it's not just an ER doctor taking care of the patient. We also turn on teleneurology, and we have 30 credentialed neurologists that are on the beck and call at any time, and they can actually treat the patient via telemedicine. And so that's a very neat thing that we have to offer at Jackson Hospital. So,
Sounds like all hands are on deck.
it is. And when, some people say, well, I'll go to a bigger hospital, Southeast, Bay Medical, and Tallahassee all utilize telemedicine as well.
Well, plus they're an hour away.
And plus they're an hour away. So we have the same ability to care for the patient besides the surgical type care. But you want to go ahead and get them the medicine as soon as possible.
Yeah, so Jackson Hospital offers the thrombolytics.
Absolutely.
So that's really cool. We're a 100-bed hospital, and to be able to have that big city medicine care
Sure.
is, remarkable for our community. So do patients typically get hospitalized onto your floor, Sarah, if they have a stroke or symptoms of a stroke? Do they come up to the progressive care, special care floor?
It really just depends on what the severity is and what the long-term goals are. Depending, there again, that's one of the reasons why the time is such a factor. We have a lot of people that have waited, and they've had symptoms for days.
Oh.
And at that point, it's past, being able to take the medication. So they may opt to just stay at our facility, because our physicians then, there's not going to be a surgical intervention at that point, and our physicians can very adequately take care of them at that point. Usually, whenever we have patients that are receiving the TPA or the clotbuster therapy, they often will be transferred to a higher level of care for continued treatment with their neurologist, whether they need to go in and have any other kind of surgical intervention or not.
Okay, all right. So again, don't mess around. If you have some of the fast signs, or if you just kind of feel
We need
funny.
you there within an hour. 3 hours is usually, it's that time sensitive. 3 hours is when we can give you the medicine. Within that 3-hour window, get in. That's why the T is so important. And so we can get that medication in you and get you taken care of.
So what are some of the ways to not even be in that situation? So what are some of the ways to avoid stroke risk?
Well, a lot of the risk you can't do anything about. If you're, well, I say a lot, several of them. Hereditary risk, you can't really do anything about that. Your gender, there's some differences with gender as far as your risk. But there are, most of the risk factors you can have some control over. Smoking, there's really not a safe amount of smoke. Avoid it altogether, even secondhand smoke. They say alcohol in moderation, 1 to 2 drinks for men, one drink a day for a woman is considered in moderation. Those are some things that you can control. Other things like hypertension, high cholesterol, diabetes, obesity, and physical inactivity, those are huge risk factors. The interesting thing is a lot of the modifications that you can make for those will work for all of them. Something as simple as eating a heart-healthy diet, getting some exercise, monitoring your weight, that will reduce your risk for cardiovascular disease as well as decrease your risk for hypertension, high cholesterol, diabetes, all in one. The biggest thing really is to make sure that you have a primary care physician, that you get established, that you go ahead and begin your monitoring. They can look and see if you have if you have any hereditary concerns that may predispose you to stroke. they can go ahead and monitor your, all of your risk factors. They can monitor your blood levels, which are also important. Sometimes no amount of diet modification or exercise can help with hypertension and high cholesterol, diabetes. It becomes very important at that point to make sure you follow your medication regimen as your physician has laid it out for you. Even if you do have these illnesses, if you have your blood pressure under control, if you keep your diabetes under control, if you keep your cholesterol under control, that also significantly reduces your risk of actually having a stroke.
So most people have control over that, and then just improve their overall health.
Absolutely.
Like you were saying, it helps you from the heart disease and the diabetes and just the poor quality of life through diet and exercise, and having a primary care doctor that's helping you with your health care. What else do you want to tell our viewers today about stroke and stroke readiness and what we're doing at Jackson Hospital?
Jackson Hospital's put a lot of time and effort into getting this acute stroke ready certification. There has been a commitment to time and personnel and other expenses that we've had to have to get here. It's just really important that we get, just the word out here in the community that, at Jackson Hospital, we really do care, because they're not just our patients, they're our family, they're our neighbors. I mean, they're our community, So.
Well, there are a lot of significant expansion of services going on at Jackson Hospital.
Absolutely.
The first diagnostic heart cath, transesophageal echocardiogram, cardioversions, those kind of things that are some of the cardiac service lines now. Stroke readiness certification pursuit, and of course the ability for Jackson Hospital to handle stroke patients right here in the community. So time is a recovery, and just doing a lot of really big city type medicine here. Of course, we have the infusion center and the full service cancer service line with the chemotherapy infusion. So the hospital is really on the forefront of growing services, stay ahead of what the community needs. But it really starts with the patient, and the patient taking care of themselves with their primary care. So any last parting thoughts on stroke? It's one of those things when people hear of it, it's like, ooh, I hope that never happens to me. So what are some of the survival and the recovery rates for people? I mean, so that way they not only know how to take care of themselves now, they know how to respond if they have FAST, but what happens if I actually am a person that has a stroke now? And I get to the hospital in time, will I be able to have kind of a ordinary life that I had beforehand?
The faster you can get there, the better outcomes that you do have. There are risks in everything, and so there's like a small 2% risk of taking the medication. Some people don't do well with it, but the alternative is you're really not going to know what the stroke's going to do.
Right.
And so the recovery rate for every 15 minutes faster you get in and get seen about is 18% more favorable for every 15 minutes. So if you get in really, really fast, you're going to get a whole lot better, a lot less disability than you would have otherwise. So as far as the rates on survival, they vary. Some of the data is still left over from 2015, but with the new Alta Place and a lot more of the rural areas like Jackson Hospital becoming able to treat these patients, the survivability is increasing daily. So I can't wait to see
That's encouraging.
The new data that comes out in February at the International Stroke Conference.
All right, and Sarah, there's actually a stroke awareness month. What month in the year is that?
That's in May.
All right, so I'm sure that you all will have you back and talking a little bit more about some of the new data and some of the new techniques for people to be able to care for themselves and respond to a stroke. What is your suggestion for family members who might be caring for a person that is a little higher risk?
Really, one of the biggest things is to go with them to their primary care office. Find out from the physician what the plan of care is, what their medication regimen is. If they are going to therapy, go with them to therapy. Find out what they need to be doing, and help them along with that. There's also support groups. Part of our initiative is going to be a stroke support group that's going to be online as well as in-house. There's all kinds of resources that we can offer at our hospital for anyone that has any questions or any needs in helping their care for their family.
All right, so if there's a phone number, who should we call if we have more information requests?
You can call Jackson Hospital and ask for Eric Miller. He's in education, or you can ask for me or Sarah. My phone number in the emergency department is 850-718-2562. I'm not exactly sure what Eric's is off the top of my head. If you call the operator and ask to speak to education, you'll get Eric Miller, who's also very, very good. And then Sarah?
My number is 718-2883.
All right, and just for the general number to Jackson Hospital, it is 850-526-2200. Again, that's 850-526-2200. If you've just tuned in, you want to go back and pull this down from the internet at chipola.edu or jacksonhosp.com. And today we've been talking with Sarah Thomas. She's the director of the Progressive Care Unit and the Special Care Unit at Jackson Hospital, and the ER director, Jason Jerkins, talking about stroke awareness and how to prepare yourself to respond to a person that may be having signs of a stroke. And Sarah said it's FAST. So Sarah, what does that acronym stand for again?
The acronym for the FAST is face, arms, speech, and time. Any kind of facial drooping, any kind of arm drifting or arm weakness, any kind of speech impairment. The biggest thing is to make sure you call 911, note that time that those symptoms start, the last known well time, and the faster the better.
All right, so again, if Jason had to say one thing in today's show, in summary, it'd be time. Get to the ER.
Absolutely time.
Get to the ER. Call 911. Don't mess around. Even if you think, oh, it's just a little spell, it's better to be safe than sorry, because your whole quality of life is hinging
Absolutely.
on that.
Yes.
So, all right, well, thank you so much for joining me. It's
Thank
been a
you for
very
having us.
enlightening
Thanks for
show.
having us.
We'll have you back again during
Okay.
May. So we're all out of time. We're so glad you joined us today on Health Matters. Have a healthy day.